When you sit among friends, it's not often that one of them talks about human strengths, powers, and the strangeness of people, am I right? Because I know it's everywhere. People are curious about stranger things in the world, but are often afraid of fake information. So, we are back with another mind-blowing video in which you'll see some of the strangest people you'll never believe are actually human. This video is full of information, wonders, and stories you have never seen before. So grab your snacks and dive with us into this fascinating journey. Number 15. Eric Sprague, the Lizard Man. Sprague underwent multiple body modification procedures, including full-body green scale tattoos, a bifurcated tongue, and subdermal implants along the forehead and arms. Rhinoplasty and ear reshaping were performed to alter facial contours, while scarification techniques added textured patterns on the chest and limbs. The tattoo work covers approximately 95% of his skin and was completed over decades in successive sessions. Subdermal implants were inserted under local anesthesia, creating raised areas to simulate reptilian ridges. His oral modifications include tongue splitting and piercings reinforced with surgical-grade titanium. The sequence of procedures required wound management, infection monitoring, and gradual tissue adaptation. Observations note that pigmentation density in large-scale tattoos interacts with skin elasticity, influencing long-term ink retention. Reports on these modifications record changes in nerve sensitivity and tissue response, particularly around high-stress areas like fingers and facial implants, illustrating the extensive planning and physical adaptation required in extreme body modification projects. Number 14. Maria Jose Cristerna, the Vampire Woman. Cristerna's modifications involve subdermal implants on the forehead, shoulders, and arms, creating horn-like projections under inked skin. Her tattoo coverage employs jaguar-inspired patterns in layered black and colored ink, incorporating shading to emphasize muscular and skeletal contours. Ear stretching and multiple piercings were applied alongside the implants, with gradual tissue expansion over months to prevent rejection. Tattoo sessions were coordinated with surgical procedures to avoid overlapping trauma on recently altered skin. Analysis of her modifications notes that subdermal implants require careful insertion angles and anchoring to prevent migration. Skin over implants exhibits distinct stretching patterns, and pigmentation interacts with underlying protrusions differently than flat surfaces, affecting visual perception. Monitoring of inflammation and scarring around implant sites is critical, and maintenance includes periodic adjustment of piercings and skin hydration. The combination of piercing, implant, and tattoo techniques demonstrates a highly coordinated technical approach, balancing aesthetic design with physical feasibility in living tissue. Number 13. Rick Genest, Rico the Zombie. Genest's body tattoos replicate skeletal structures and decomposition patterns, covering nearly all visible skin, including the scalp. Dark shading simulates musculature and hollow cavities, with additional scarification applied to the head to produce three-dimensional texture. Tattoo application required repeated layering to maintain anatomical consistency across the body's contours, and sessions were spaced to allow skin healing. Ink saturation, line density, and shading techniques were adjusted according to the curvature and thickness of different body areas. The scalp and facial regions demanded specialized needle depth control to avoid nerve damage. Pigment absorption and long-term retention were evaluated in areas with high skin movement, such as joints and the torso. Tattoos were designed to align with bone landmarks, making it necessary to map skeletal points before inking. Observations of tattoo longevity indicate that repetitive motion areas can show faster fading, and scar tissue integration affects visual contrast, which requires adaptive shading techniques for uniform appearance across large body surfaces. Number 12. Rodriguez Hernandez, record-breaking feat. Rodriguez Hernandez exhibits feet measuring 16 inches in length due to an overactive pituitary gland causing gigantism in the extremities. Medical assessments reveal bone growth in the metatarsals, and phalanges exceeds typical adult development by 60 to 70%, with corresponding soft tissue expansion, including ligaments, tendons, and plantar fascia. X-rays document proportional enlargement of toes and heel bones, while gait analysis indicates compensatory mechanics to maintain balance during walking. Footwear adaptation includes a custom orthopedic design to support weight distribution and reduce strain on the ankle joint. Dermatological evaluations note skin stretching and pressure point formation over extended surfaces, requiring ongoing care to prevent calluses or ulceration. Circulatory monitoring shows altered blood flow patterns, with veins and arteries adjusting to the increased extremity size. Functional testing of strength and flexibility confirms range of motion limitations, while muscular adaptation maintains plantar and dorsal foot stability under typical load-bearing activities. Number 11. Rolf Buchholz, Extreme Piercings and Modifications. Buchholz possesses more than 500 body modifications, including subdermal implants, piercings, ear reshaping, and tongue splitting. Detailed photographic documentation indicates the distribution of metallic jewelry spans the lips, eyelids, ears, tongue, and torso. Skin puncture points are monitored for signs of inflammation, hypertrophic scarring, or tissue rejection, while titanium and surgical steel materials are employed to minimize allergic reactions. Sequential procedures were timed to allow healing intervals between new piercings and implant insertion, avoiding overlapping trauma. Surface tension in high movement areas like joints is measured to determine optimal placement and prevent tearing. Tattoo integration accompanies certain implant regions to mask scarring and reinforce aesthetic symmetry. Medical observations indicate gradual epidermal accommodation around implants, and long-term structural stability relies on tissue elasticity, ligament support, and vascular supply. All right, now let's move to Number 10. Devendra Suthar, Extra Fingers and Toes. Devendra Suthar exhibits a total of 28 digits, with polydactyly affecting both hands and feet. Skeletal imaging confirms the presence of additional phalanges, with fully formed joints, tendons, and ligaments that allow functional movement. Muscular structures adapt to the expanded extremities, providing grip strength and dexterity across the extra digits. Dermatological assessment reveals overlapping skin folds, nail formation patterns, and enhanced sensory innervation, with peripheral nerves extending to all additional phalanges. Surgical records indicate that no corrective procedures were applied to remove or reshape digits, allowing natural growth patterns to remain intact. Motion analysis demonstrates altered gait mechanics and grip orientation to accommodate the additional toes and fingers. Radiographic measurements confirm symmetrical bone length and alignment, while soft tissue thickness supports weight distribution and articulation. Number 9. Supatra Nat Sassophane, the hairy girl. Supatra Sassophane has Ambras syndrome, a rare congenital condition that results in generalized hypertrichosis. Hair growth covers almost the entire body, including the face, arms, and torso, with follicles producing dense pigmented hair at rates significantly above average. Scalp hair coexists with fine vellus hairs across other regions, and dermatological measurements document hair length, diameter, and follicular density. Hormonal profiling shows no detectable androgen abnormalities, indicating the overgrowth is primarily genetic. Skin biopsies confirm normal epidermal and dermal structures beneath the hair, with follicular activity remaining active throughout adulthood. Imaging studies demonstrate that follicle distribution follows standard human patterns, though the increased density alters tactile sensation and thermal regulation. Hair removal interventions are limited due to regrowth speed and risk of follicular trauma, and physiological monitoring indicates that thermoregulation adapts to compensate for widespread body coverage. Number 8. Julia Gnusa, the Illustrated Lady. Julia Gnusa's body is extensively tattooed to cover scars caused by porphyria cutanea tarda, a genetic condition affecting skin fragility. Large-scale tattooing spans the arms, legs, torso, and portions of the face, with ink layers applied over sensitive scar tissue. Skin elasticity and tensile strength were measured to guide tattoo needle depth, preventing tearing or excessive bleeding. Tattoo pigments include standard black and colored inks, adjusted for absorption rates over scarred dermis. Procedural sequencing involved multiple sessions over several years, allowing tissue healing and minimizing cumulative trauma. Dermatological evaluation tracked epidermal regeneration, ink retention, and color consistency across scarred versus non-scarred areas. Additional monitoring included histological observation of pigment deposition and localized inflammatory response. The interplay of scar tissue architecture and ink deposition produces unique texture patterns, and protective measures were implemented to reduce hypertrophic scarring or keloid formation. Number 7. Kim Goodman, eyeball protrusion record. Kim Goodman is capable of voluntary ocular protrusion, displacing the eyeballs up to nearly 12 millimeters from the orbital socket. Examination using ophthalmic imaging confirms that the extraocular muscles and connective tissue allow this movement without compromising the optic nerve or intraocular pressure beyond safe physiological limits. Corneal and scleral integrity are maintained during protrusion, with no observed long-term edema or vascular disruption. Imaging also reveals that the eyelid retractors coordinate with muscular expansion to allow extended protrusion while protecting the ocular surface. Neurological assessment indicates voluntary control over the levator palpebrae superioris and rectus muscles, permitting repeatable and precise positioning. Soft tissue measurements track changes in orbital fat and conjunctival flexibility, which accommodate the forward displacement. And now let's talk about Number 6. Anthony Lafredo, the Black Alien. Anthony Lafredo has undergone full-body black ink tattooing, skull and forehead implants, and surgical removal of portions of his nose and ears. Subdermal implants along the forehead, jawline, and hands were inserted under sterile conditions to create protrusions resembling alien anatomical features. Tongue bifurcation and lip modifications were performed to achieve symmetry with other craniofacial alterations. Sequential tattooing was applied over large surface areas, requiring multiple anesthetic sessions and monitoring for pigment retention and skin integrity. The combination of implants and extensive ink coverage required careful observation of tissue elasticity, vascular supply, and nerve positioning to prevent necrosis or permanent damage. Post-procedural imaging documents the integration of implants with subcutaneous tissue, while dermatological evaluations assess scar formation, epidermal reaction to ink saturation, and maintenance of sensory function. Number 5. Petrus Gonçalves, hypertrichosis case. Petrus Gonçalves presented generalized hypertrichosis affecting both the face and body, with hair density significantly higher than average human distribution patterns. Follicular analysis indicates that primary hair follicles produced thicker, more pigmented hair, while secondary follicles were active across extensive skin regions. Anthropometric studies of limb and facial coverage record uniformity in length and density, with minimal asymmetry. Archival medical accounts document maintenance and grooming approaches adapted to manage hair growth and prevent follicular irritation. Observations include hair alignment, texture variation between scalp and body, and seasonal changes in growth rate. Genetic studies link the condition to X-linked dominant inheritance, affecting the expression of hair growth regulatory genes. Muscle and skin interaction beneath dense hair was noted to allow normal mobility, with no significant restriction in joint range of motion. Skin morphology, including sebaceous and sweat gland distribution, remained within expected physiological norms despite hypertrichosis, demonstrating structural adaptability under continuous follicular activity. Number 4. Felix Verla, Elastic Skin Man. Felix Verla exhibited extreme skin elasticity due to a connective tissue disorder consistent with Ehlers-Danlos syndrome. Measurements show abnormal extension and recoil of dermal layers, with the ability to stretch skin multiple times its normal length without tearing. Histological analysis demonstrates altered collagen fiber density and alignment, providing reduced tensile strength but increased flexibility. Limb manipulation tests confirm range of motion preservation despite hyperextensible skin, while joint stability is maintained through adaptive musculoskeletal alignment. Soft tissue imaging reveals a layered dermis capable of sustained stretching under applied force, with minimal microtrauma observed during repeated testing. Skin hydration, elasticity recovery rates, and epidermal thickness were quantitatively measured, demonstrating resilience under tension. Blood flow and capillary integrity were monitored during extension to prevent vascular compromise. Number 3. Cheney Hultgren, the Space Cowboy. Cheney Hultgren performs extreme body modification stunts, including sword swallowing, nail suspension, and transdermal piercings. Sword swallowing requires relaxation of the upper esophageal sphincter and careful alignment of the pharynx and esophagus to prevent tissue damage. Medical evaluations show minimal mucosal abrasion when performed under trained conditions. Nail suspension involves inserting hooks through dermal tissue in the back or limbs, distributing body weight through multiple attachment points to avoid tearing or excessive strain. Piercing locations are reinforced with surgical-grade steel to minimize tissue rejection. Muscle coordination and core strength are critical to maintain balance during suspended positions. Hultgren also practices repeated desensitization to mitigate nerve response in areas under mechanical load. Session documentation tracks healing intervals, tissue adaptation, and gradual tolerance increase, while careful sterilization protocols reduce infection risk. Performance sequencing follows anatomical mapping to prevent interference between successive modifications and stunts, maintaining the structural integrity of skin and connective tissue. Number 2. Manfred Koenig, Longest Human Tongue. Manfred Koenig's tongue measures over 10.1 centimeters from tip to base. Structural imaging confirms complete musculature, including intrinsic and extrinsic muscles, with normal attachment to the hyoid bone and mandible. Range of motion tests demonstrate the ability to extend the tongue forward while maintaining mobility for speech and swallowing. Surface papillae density is consistent with typical human tongues, and the muscular cross-section shows no hypertrophy beyond elongation. Lingual vascular supply is sufficient to support tissue viability at maximal protrusion. Oral cavity assessments measure the interaction between tongue length and palatal clearance, and occlusion tests confirm minimal interference with dental alignment. Sensory testing indicates intact taste reception and tactile sensation across the extended tongue surface. Measurements of tongue thickness and flexibility were recorded, along with repeated extension trials under controlled conditions to ensure muscular and vascular structures function without strain. Number 1. Luciano Pavarotti, the Human Alarm Clock. Luciano Pavarotti possessed an exceptional vocal range and resonance capable of producing sound frequencies detectable at considerable distances. Acoustic analysis records his upper register reaching high C6, with sustained amplitude exceeding 90 decibels in concert conditions. Vocal fold length, mass, and tension were measured through laryngoscopic imaging, showing optimal fold thickness and elasticity for vibrato control. Subglottal air pressure and diaphragmatic support were quantified during sustained notes, demonstrating the physiological basis for long-range projection. Resonance cavities, including pharyngeal and oral spaces, were examined to map harmonic amplification, revealing precise tuning of formants for clarity and power. Muscle coordination between the cricothyroid and thyroarytenoid muscles allowed fine pitch modulation and dynamic range control. Auditory measurements during performance showed minimal distortion across concert halls due to optimized vocal fold vibration and resonance harmonics. The human body and mind can push boundaries in ways that defy expectation, and these remarkable examples prove that reality often surpasses imagination. If this video sparked your curiosity, take a moment to like it, leave a comment sharing your thoughts, and pass it along to friends. Subscribing ensures you won't miss future explorations into extreme human abilities and rare conditions. Your attention and engagement make these discoveries meaningful, and I deeply thank and appreciate you taking the time to watch, reflect, and share.